Hi, good morning everyone. I am Puan Sumati, nursing instructor at UniKL Royal College of Medicine, Perak. Today, me and my colleague
Puan Izzawati binti Mak Johor, also a clinical instructor UniKL RCMP.
Today, both of us are going to demonstrate on how to administer subcutaneous injection. Before we start the practical part of it, I would like to stress on some of the basic principles of handling syringes and needles. First of all, in administration of subcutaneous injection, we have two types of syringes available. One is called the insulin syringes, which comes with the attached needle, and the other is called tuberculin syringe, which comes without a needle. Both these syringes amount to 1 ml, and it is divided into units. So each line is 1 unit of medication. Please take note, it's 1 unit and not 1 ml. So the whole syringe is actually 1 ml. Okay. So for these insulin syringes, you don't have to change the needle throughout the procedure until you administer the injection to the patient. As for this tuberculin syringe, we need to attach the needle accordingly. Before that, let me tell you which part is clean, which part should be maintained sterile. The whole injection procedure is a clean procedure. However, you need to maintain sterility of certain parts of the syringes and needles and the medication in order to avoid contamination and prevent unnecessary infection. First of all, in a syringe like this, the tip of the syringe and the inner part of the barrel is considered sterile. So please do not contaminate these two parts by touching. When you are handling and when you are preparing, do not touch these two parts. And as for the needle, you should not touch the tip of the needle. And I would like to stress, there are two types of needles available in the hospitals. Both these needles are 26 gauge, which are actually used for subcutaneous injection. However, they come in two different sizes. One is a needle of 1 inch, which is longer, and if we use these needles, injections should be given at 45 degrees in order to reach the subcutaneous tissue. As for this needle, it is 1/2 inch, which is shorter, and in order to give a subcutaneous injection, you administer at 90 degrees. Are you clear? Okay, so when you are attaching the syringes to the needles, you have to perform medical rub or medical hand wash. And then you remove the syringe from the packet and you attach to the needle without touching the tip. You attach it like that. Okay? Now it is ready for administration. Are you clear? Hope this clarifies your doubts. And now, Puan Izzawati will do the practical part of it. She will demonstrate to you how to administer injection subcutaneously in a proper manner without violating any of the principles. Alright, now we will start the practical part of the administration of subcutaneous injection. First of all, you need to prepare. Verify patient and check doctor's order. Check the medication administration record and assume that equipment and medication has been prepared according to the procedure manual or the policy of the hospital. Prepare the environment, ensure bed is locked and there is privacy.
Good morning, mister. I'm Izawati, your nurse today. So, this morning your blood sugar is 9 millimole per liter. I will give your insulin injection within half an hour. You can take your breakfast. Before that, may I know your name, please? Mr. Nick. Check the ID bank. Mr. Nick. MRN number 8910. 8910. Okay.
So, she read and explained procedure to patient, the medication to be administered, and the purpose of it. This is to establish rapport, gain cooperation, and allay anxiety. She also checked doctor's order and patient's medication administration record to prevent medication error. Now, she will prepare the medication. So she has checked it's the right patient, and now she will check that it's the right medication. Perform first check of the medication. Assume that she has performed hand hygiene.
Circuit Atropine 10 unit TDS. Expiry date December 2020.
So she has checked it's the right medication, and now she's ready to prepare the injection. So take the necessary syringe and needle, loosen the wrapper, remove the capsule from the top of the vial if it is a new vial, and do not touch the rubber part of the vial. Attach the needle and the syringe without contaminating the parts that I told you earlier. Cleanse the rubber top with alcohol swab in a circular motion and allow it to dry. This is to maintain asepsis. Allowing alcohol to dry prevents needle being coated with alcohol and mixing with the medication. She has attached the withdrawing needle to the syringe. And now she is going to withdraw the required amount. Remove needle cap and draw amount of air equal to the volume of medication prescribed. Inject the air and tilt the vial and ensure that the needle is below the level of the medication. Withdraw the required amount of the medication by holding the syringe and vial vertically at eye level. Recheck amount of medication in syringe. Remove the needle and the syringe from the vial. Pull the plunger back slightly. Remove the withdrawing needle from the syringe and discard into the sharp bin. Attach a new needle, 26 gauge also. And then you tap the syringe if necessary to remove the air bubble and disperse medication to the tip of the needle. If there's no air, you can push the plunger gently Recheck amount of medication in syringe comparing to medication volume required. So in this case, it is subcutaneous 10 units of atropine. And now she's ready to administer the medication to the patient. Ensure there's privacy to maintain patient's dignity. Ensure patient is in a comfortable position. Don gloves if it is an infectious case. And now perform the check of medication, which you have seen her doing. Prepare a piece of alcohol swab and a dry swab. Locate the site accurately. Today she is going to perform at the deltoid.
Okay, mister. Now I want to give insulin injection. Again, may I know your name, please? Mr. Nick. Check the ID. ID bank, Mr. Nick. MRI number 8910. 8910.
See, she has confirmed with the right patient again. She has also located the site. And now, cleanse site with alcohol swab. To locate the deltoid, place your first finger at the acromion process and 3 fingers below the acromion process. The triangle above the axillary line and below the 3 fingers is the area where you need to inject. Cleanse the site with alcohol swab using circular motion, moving outward about 5 centimeters. This is to reduce the number of microorganisms and also allow alcohol to dry. This is to prevent skin irritation from alcohol. Place and hold dry cotton between 3rd and 4th fingers of non-dominant hand. Hold syringe with dominant hand between the thumb and index finger. Remove needle cap with non-dominant hand. Grasp about 2.5 cm of skin or fatty tissue between thumb and finger of non-dominant hand. Tell the patient to breathe in and out.
Okay, sir. Breathe in and out.
Insert needle with dominant hand in a smooth and quick motion. As I said earlier, 45 angle if needle is 1 inch and 90-degree angle if needle is ½ inch. This is to facilitate injection into subcutaneous tissue. Quickly release skin fold and steady the syringe. Stabilize the syringe and needle with non-dominant hand. Aspirate by pulling the plunger with dominant hand and observe barrel of syringe. For blood return. If there is no blood return, then you are at the correct subcutaneous tissue. Inject the medication steadily and slowly while holding the syringe steady. Okay, after you have administered, she has withdrawn the needle smoothly and applied gentle pressure using dry cotton. Discard the uncapped needle and attach syringe into the sharp beam. Tidy up the area and make patient comfortable. After administration, perform step 9 and 10 of 10 rights of checking. Step 9, write documentation. Document the relevant data, including the time of administration, medication name, dose, route, and site of injection. This is for documentation purpose and for further management. After that, you need to perform the right evaluation. So you have performed 10 right or checking accordingly. Subcutaneous injection has been administered successfully under aseptic technique. Effectiveness of the medication is evaluated at the time it is expected to act. So after the injection, normally you check the patient after half an hour to see if there's any signs of hypoglycemia and to ensure that patient has taken his meal. Appropriate follow-up conducted based on findings that deviate from expected, and any abnormalities should be reported to staff in charge of the doctor. Thank you.